Okay, one of our speakers is going to have to call in, so we'll just have to imagine how he looks. All right, well, I will welcome everybody now. Good afternoon, everybody. Welcome. Friends and supporters of the Gray Panthers NYC. We're meeting again on the last Tuesday of the month to consider how we can join together to transform long-term care in our country. So I'm Michelle Arnaud, and I'll be moderating the webinar. So kindly put your questions and thoughts in the chat. Before we start, I have a brief announcement. I'm excited and pleased to report that Life Care Foundation Malawi now appears on our website. It's under the In Residence tab. I think some of you attended our December webinar, which featured that group. So we'll be following their progress, and we invite you to join us in that journey. So also a quick reminder that our organization was founded in 1970 by Maggie Kuhn, who set out to combat ageism and achieve social justice through intergenerational collaboration and many other multisyllabic words. Activism. So in supporting the mission, our chapter's been conducting a monthly webinar series since 2021. We're hoping to provide a safe space to discuss how ageism impacts our world with the goal of making a positive difference. So specifically during these Tuesday sessions, we've been addressing the issue of long-term care and nursing homes. And during this hour, we agree to disagree respectfully as we join together to promote dignity in aging. The intention is to build bridges and create unity among advocates, residents, families, and industry representatives, as well as across generations. So we're committed to continuing this series until we see some movement, some slight movement toward the positive change that we envision. All our webinars are recorded and available on our website, and you can find them on gpnyc.org, graypanthersnyc.org. Our topic today is the national demonstration to reinvent nursing homes. And we have two distinguished presenters, Anne Montgomery and Roger Myers. Anne Montgomery will present a proposal that she co-authored on how to use federal funding to reallocate monies in order to improve the quality of life in nursing homes. There are three key components to her proposal, and she'll present them today. This proposal was submitted to Senator Ron Wyden last year by actually Jack Kupferman, me, and one of our volunteers. So today, Anne will begin the presentation. Many of you are familiar with Ms. Montgomery. She's a longtime policy strategist and health services researcher who specializes in long-term care and support systems for older adults and individuals living with disabilities, with extensive experience in developing actionable strategy and governance proposals. Ms. Montgomery served as an analyst for the Senate Special Committee on Aging and the House Ways and Means Committee, among many other positions. Currently, she's an independent consultant working with the National Committee to Preserve Social Security and Medicare and the Center for Innovation. In addition to that, she's an active member of the Moving Forward Coalition, as well as the Live Oak Project, both of which aim to implement reforms recommended by NASM, the National Academy of Sciences, Engineering, and Medicine. She is also a key consultant in the Administration for Community Living's Capacity Building Initiative, focusing on the direct care workforce. She received her degrees from the University of Virginia and Columbia University. Our second distinguished speaker today is Roger Myers, President and CEO of Presbyterian Villages of Michigan, a nonprofit organization founded in 1942, currently serving over 7,000 older adults of all faiths in 34 communities around Michigan. He's responsible for system-wide leadership, including governance, advocacy, communication, organizational development, as well as philanthropic relationships. In addition, he serves on a variety of committees and community boards on the national, state, and local levels. He received his degrees from Western Michigan University. He's also a licensed nursing home administrator and a member of the American College of Healthcare Administrators and the American College of Healthcare Executives. So now it's my honor to pass the virtual mic to Ann Montgomery. Thank you, Ann.
Well, good afternoon, everybody. I'm so honored and glad to be
Ann,
on Zoom.
excuse me
This
for
is so magical community. Oh, I think we need our slides, if that's okay.
Ann, can you hear me?
Oh, yes, we can hear you. Is that Roger?
Roger. Yeah, Roger's on.
Great.
Yeah.
Hi, Roger.
Thank you.
Okay, so we have two
Great.
presenters.
All right. Well, now I'll pull up the slides. Wonderful.
Okay, wonderful. So as Michelle noted, I'm Ann Montgomery. We're hoping to inspire you today to think differently about getting old. And on the computer I'm using now, actually, there's a sticker pasted on it, which says old people are cool. And here is an example of probably the coolest old person ever, Albert Einstein. As we know, he changed the world without a doubt. And you know how he did it? By thinking differently, by sharing his ideas and insights and making sense of what previously had not been well understood or even grasped. So today we're going to talk about how we can approach being old and not just stepping out of the way, off the stage, waiting for the end, but rather living and thriving, just like Albert Einstein did in this wonderful photo. We're going to be changing the channel, turning the page from the current isolating, tedious institutions that we've built to keep old people out of sight into something completely different. We call it the Einstein option in honor, obviously, of Albert Einstein, and that stands for evaluating innovation in nursing home systems to end institutionalization. Check out the bold-faced characters and you'll see how we got there. This incredibly clever term and acronym was coined by the talented Rick Gamache of Aldersbridge Communities in Rhode Island, and you should all get to know him. Hopefully he's on this call and we can hear a little bit from him later. Okay, next slide. Okay, so this is Maggie Kuhn, as I'm sure most of you know, founder of the Great Panthers movement, which combines the energies of young and old into a movement. And there's so many more millions of us now who are positioned to take forward what she started. And I know that's why you're all here, to channel her fierce dedication and compassion to shift the perception of what it means to be an older person. Next slide. All right, to introduce this, I first want to thank Joe Angelelli of the University of Pittsburgh Medical Center. Joe helped me put this deck together, and he's one of the most thoughtful people I know. He considers social impact issues all the time in the context of long-term care and the basic supports and services all of us need to live cooperatively and interdependently, not independently. But as you can see in this slide, policymakers and stakeholders haven't quite gotten the message. Here you can see that in comparison to other countries, we spend billions and billions on healthcare services in the US that are not long-term care. But now that we are living in an age of much greater longevity, the question arises, isn't it time to shift some of that spending toward long-term care? And in the process of doing that, another question arises, which is, can we actually save on healthcare spending by investing more in cost-efficient long-term care? Next slide. Before answering that question, this shows how we spend our long-term care dollars now. As everyone knows, Medicaid is a very large payer, but only slightly larger than what people spend out of their own pockets, a fact that I think is often forgotten. And Medicare is quite a large payer as well in the SNF space, which doesn't get talked enough about, but we will talk about that a little bit more later. Okay, next slide. All right, here we're going to be considering whether we can save money by spending more on long-term care. And I know it's hard to see, but if you focus in on the little tiny dot below the downward pointing blue arrow, you'll see that it represents an investment of $600 million over 3 years that we're proposing to transform the entire long-term care system. That's the Einstein option. This is a rounding error in the federal budget, as Rick Gamache likes to say, when you compare it to the spending that is projected for that same time period of $675 billion. Put another way, a $600 million innovation investment would be 0.1% of total projected spending on skilled nursing facilities. Next slide. An innovation investment, if Congress would like to do that, and we hope they will, and we need your help to get them to do it, could be attached to the legislative authority you see here. It's a provision I wrote along with other colleagues into the Affordable Care Act back in 2010. It's section 6114 for those of you who would like to look it up. It hasn't yet been used for its intended purpose of transforming the nursing home system. That's where we need your energy, all of you out there, to help push this over the finish line and into action. All right, next slide. And here's a precedent that we can cite and look to. The Department of Veterans Affairs has been given the resources for innovation not long ago in 2022 to invest in overhauling the nursing home system that they run. So why can't we do it elsewhere? Next slide. This is an illustration of how we can improve quality of life and achieve savings if we invest in doing both. The 2015 article mentioned here references the greenhouse model, and I'm sure many of you have heard of it. It's a cottage-style nursing home model, features private rooms, private bathrooms, shared living space, which is quite delightful. It includes an open kitchen, it includes a dining room, easy access to the out of doors. And equally important, if not more important, staff are trained to provide person-centered elder care, not task-oriented institutional care. I'm also going to mention a 2016 article by researcher David Grabowski and others, which found that greenhouses are associated with Medicare savings of $7,746 per beneficiary annually, which the authors suggest was likely due to reduced spending on hospitalization and Medicare financed short-term skilled nursing stays. So to play this out, if we think about a larger investment, now we're talking a $25 billion investment, which you see here, which would need to be fueled really by private investors. In a what-if scenario, if we built 25,000 greenhouses or household unit homes, each with 10 beds, so 250,000 total, then let's examine how this could play out over time. Let's say that hypothetically, we started making this investment back in 2016 in building greenhouses. By 2025, we could have 250,000 greenhouse beds, representing about 15% of nursing home bed capacity that we have effectively replaced from what we have today, which is mainly institutional. And if we multiply that 250,000 by 7,746, we arrive at 1.9 billion in savings in 2025. And then over time, that 1.9 billion becomes 29 billion over 15 years, and that takes us to 2040. By that point, we would have saved Medicare 4 billion and paid back the 25 billion investment. Okay, stay with me. Now let's plug this into the world of social impact investing, where the federal government is playing a catalytic role, but doesn't finance the whole thing. So let's assume the federal government incented 1 million per 10-person household, with the rest left to the private lending market, because when the government leads, it becomes the ultimate market maker. We're looking at you, Department of Housing and Urban Development. And then we add in the logic of social impact investing, which is to borrow against future savings. So here's an illustration of how it would work. If we take the example of a 200-bed county-owned nursing home and we convert it to 20 10-person households, greenhouses or similar household units, we take those 200 beds, we multiply them by 7,746, we get 1.5 million in savings per year. Over 15 years then, those savings grow to 23.2 million. So we use 20 million of the 23 million in savings to get the project financed, and we would still save Medicare 3 million over that period. Next slide. This slide basically summarizes some of what I just said and takes it forward in a couple of additional ways. I hope that Joe and Carrie and Roger and all of you agree that investments of this kind are absolutely worth it, because not only do we project that Medicare would spend less, but we would save many lives. Because remember, the institutional style of shared rooms, too few staff, poorly trained staff, poorly prepared staff, many of whom end up needing to work more than one job in order to pay the rent, inadvertently helped to spread COVID in nursing homes more than in any other setting during the pandemic. In other words, to be in a nursing home is to be extraordinarily vulnerable, and that really should be totally unacceptable. Next slide. Okay, here you can see that what I'll call the private room paradigm is spreading quickly, not fast enough, but the most farsighted entrepreneurs in the residential care sector are busy building greenhouses that serve not just those with money, but the Medicaid population in good part as well. Next slide. Okay, now we get to the policy part. That's the Einstein option, as we call it. It has 4 components, actually, because we've added one on the direct care workforce, and each would be financed in a catalytic way. This happens by the federal government, and this is our 600 million from the earlier slide for those of you following the numbers. Next slide. Okay, here's the first component. It's got a lot of details. I'm not going to be able to go through them all, but I really hope you'll read it carefully. I know you'll get the slides when you get the link from Carrie and from Michelle. Basically, this is about how to make culture change or person-centered care happen across the country. And we have many skilled practitioners, I'm sure, on this call, whether that's Joanne Radar or Rick Gamache or Barry Barkin, Teepa Snow, folks at the Eden Alternative, Susan Ryan, many really who've been doing this work for decades, many of you out in the audience. And I've had the pleasure and the honor of evaluating this type of work as a researcher when I was at Altarum. And I know that if it's implemented carefully, it makes an enormously positive difference for both residents and staff. Next slide. Okay, in this component, this is what we call tier 2. There is a shift to the private room paradigm and to maximizing quality of life and quality of care for elders who are living in a household with their peers. It is truly their home. It is not a step-down hospital. And when you read through the details later, again, I hope you'll appreciate that we need your help to galvanize not only the healthcare sector, but the housing sector, and to get the federal government to lead in both sectors. Next slide. All right, this slide is basically a nod to Roger Myers and to Tomei Rivertown, which he'll describe shortly. If we can do the kind of work that I've been describing, some catalytic and social impact investing, if we can connect the dots between housing that allows for easy delivery of supportive services and access to medical care is needed, then we can turn that into a continuum of care system in hundreds and thousands of wonderful communities. It takes a village, a willing federal government, willing investors, and lots of amazing individuals like yourselves who can't wait to do this kind of life-affirming work. Next slide. All right, the critical role of what we call CNAs or certified nurse aides is the focus of this 4th component that we've just added. And Lori Porter, I don't know if she's on this call, but she's wonderful. She calls the workforce the care force. And I think that we might want to consider shifting to that term. Right now, it's not in good shape, and most people know that. There are multiple efforts to try to change that. And one that we might be able to talk about later, if anyone is interested, is the notion of not leaving most of the training to employers. In other words, if we want to professionalize and lift up the care force, we can create free, online, top quality trainings, videos, and so on that can be posted on a federal government website like the Department of Labor, perhaps CMS, states, and so on. We can do this. We can also run a high quality marketing campaign to recruit people. And we really need to do it, as this slide says, or we will be in a pinch and we won't be able to offer the services that we know we need to offer and that we want to offer. So that is the Einstein option. It does require, more detail than I have time to go through now, but I hope this is a good first step. And I hope you join in our movement. Thank you so much. Next slide. And I'm going to go to Roger. Thank you.
And thank you very much. That was excellent. Can you hear me?
Yes.
Yeah, I apologize for the Zoom not functioning properly. I thank you all for allowing me to join today with you, and really congratulate the Gray Panthers of New York City for the leadership that you've demonstrated with these, not only the Transformation Tuesdays, but for all of the other advocacy work you're doing. It's so critically important. That's where most of us believe the change will come. It'll be consumer-driven change. And so I'm, again, pleased to join you. As mentioned in the introduction, I've been in this field for a long time, and I've seen the desperate need for change. And fortunately, I've been able to serve in an organization with Presbyterian Villages of Michigan that has embraced the notion of change and transformation and really doing things differently. So I'm going to talk about the Tomei Rivertown neighborhood and how we've been able to create a continuum, an affordable continuum that really meets the needs of elders, including those that are very frail and also elders that are very low income. Our efforts in transformation really got started probably a little over 20 years ago when we met up with Dr. Bill Thomas. I think many of you are familiar with Dr. Thomas. He was the real innovator of the greenhouse concept that has evolved significantly with the leadership of Susan Ryan and many others. I think now upwards of 300 or more than 300 greenhouse homes. There's also what are referred to as small houses that have some of the elements of the greenhouse, but not all of the components. PVM was an early adopter of the greenhouse model about 20 years ago. I think we had the second or third greenhouses that were developed, and we saw, up close and personal, the huge impact that it had on the quality of life of the elders who live there and their family members, as well as the caregiving staff, the Shabazines, as they're known, and all of the workforce that was involved with the greenhouses. I mean, incredible impact. The things that maybe you've read about, or maybe you've seen some of the videos of how quickly people improved in terms of the quality of their lives, and also the impact on staff in terms of reduced turnover and staff satisfaction. You also probably have read the experiences through the pandemic of the greenhouses nationally and internationally in terms of a much lower frequency of COVID, and the mortality rates were much lower than a traditional nursing home. So that was 20 years ago. Now to talk a little bit about the Tomei Rivertown neighborhood, and just to address the name Tomei. The Tomei Foundation was a significant philanthropic funder. They contributed $5 million to the overall economics of the project, and so we named the entire neighborhood after Tomei. So the Tomei Rivertown neighborhood is what it's been known as. And just a word about Mr. Tomei, the individual who created the foundation. When he retired, he was the controller of the Washington Post newspaper. And he and his wife set up this foundation to largely fund innovations in aging services, as well as a couple other areas. And he targeted his funding to be in Maryland and in Michigan, because he was born and raised in Michigan, went to the University of Michigan, and then of course through his professional life with the Washington Post, spent a lot of time in Maryland. So again, extremely generous. It was a spin down foundation. So I hate to tell you that the money is all spent now. They spent it in many different ways in those two states, and PVM was blessed to be a recipient of much of that money. So that's a little bit about Tomei. So in 2008 and 2009, we began talking about how to create a continuum of accommodations, services, and care that would be accessible to people with moderate to low income. You probably have heard about what used to be referred to as continuing care retirement communities. That acronym was changed a few years ago to life plan communities. But those types of communities have many benefits. but unfortunately, they are generally accessible only to people with financial means, and in many cases, significant financial means. So if you were moderate to low income, a life plan community just wasn't something available to you. Well, our goal was to create that type of continuum in Detroit, and we began working on it, as I indicated, in 2008 and 9, and we were able to attract partners with us, and our key partners were the United Methodist Retirement Communities. They are now known as Brio Living Services, so they were a key partner. Another key partner was what's now known as PACE Southeast Michigan, a PACE program of all-inclusive care for the elderly. And back at that time, it was called the Center for Senior Independence. The PACE program is a partnership between Henry Ford Health and Presbyterian Villages of Michigan. We also were able to attract the Detroit Housing Commission. We attracted the Detroit Area Agency on Aging. We attracted the U.S. Department of Housing and Urban Development. So we created this vision to establish a continuum. And the pieces of the continuum that we have in place today, and Ann has visited there several times, Susan Ryan has visited there several times. We certainly would invite any of you to come to Detroit to see what has been established, and now for over 10 years. But the components on the campus are an area of what's referred to often as independent living, but it's basically apartments, subsidized apartments that were funded through the HUD Section 202 program. And so we've got 50 apartments on the campus. A second phase is what was referred to as affordable assisted living apartments, and that is 80 apartments that provide housing to individuals that are quite frail, that are subsidized either through the Detroit Housing Commission or through the Michigan State Housing Development Authority. So all but 5 of those 80 apartments are subsidized. So there are 5 unsubsidized apartments. Also, the people that live in the affordable assisted living apartments would either have the Medicaid waiver that's provided through the Detroit Area Agency on Aging, or they would be paid participants. So all of the people that live in the affordable assisted living have some degree of frailty that would qualify them to live in a nursing home. In fact, many of the people that moved into the affordable assisted living had been in a nursing home before moving into their apartment. The third area is PACE. So on this campus is a full PACE day center. And I believe many of you are familiar with PACE. It's certainly a growing program. Our program is the 5th largest program in the country. And so the PACE Center that's on the campus of Tomei Rivertown is one of 8 centers that we have in Southeast Michigan. We serve 3 counties, Wayne County, which is where Detroit is, and then Oakland and Macomb counties, which are just north of Detroit. So we have 8 PACE centers, and we've got 4 or 5 more planned. Our goal is to get to probably somewhere around 3,500 PACE participants in the next 3 or 4 years. So then the fourth component of the campus is the Weinberg, the Harry and Jeanette Weinberg greenhouses. And we decided to adopt fully the greenhouse model. So these are they adhere to the disciplines of the greenhouse project. And we have 2 households on the campus. It's a multi-level building. So on the second floor and the third floor of the building where the greenhouses are occupied, you'll find the 2 households. As was mentioned, there are 10 elders that live in each household, and the staff are what are called Shabbazines. They're what some people refer to as universal staff members, so they provide all of the care to the elders. We also decided that the greenhouses would be dedicated for PACE participants. So the combination between PACE and the greenhouses has really worked out extremely well at Tomei Rivertown. The 5th component, and this is a component that's not yet been completed, we're still working on it, was a community service center. Some of you may have heard of the Mather Cafes in Chicago, and we've certainly been impressed with what Mather has done in Chicago. But it would basically be a resource, could be a cafe, could be an expanded senior center that would serve not only the people that live at Tomei Rivertown, but in the surrounding neighborhoods in that part of Detroit. And the location in Detroit is 1 block off of the Detroit River and about less than a half a mile from the Detroit Renaissance Center, which is, kind of what is often looked at as the symbol of Detroit. And so we're really kind of right in the downtown area, just a block from the river, and a lot of vitality going on in the area. Total development cost of over $55 million, federal, state, county, city funding. The National Affordable Housing Trust was the limited partner for the tax credit project, which was the affordable assisted living piece. And then philanthropy. Philanthropy was about 12 million of the 55 million that was invested. This was, again, certainly a risky proposition when we were doing this. We undertook it during the middle of the Great Recession, but it's been proven to be very effective. It's effective economically, financially. Certainly the quality of life for the participants, for the residents, has been very, very high. And we are now replicating this in 4 other locations. So we're replicating this in Flint, in Port Huron, in Pontiac, and in Westland. Those are all communities, mostly in Southeast Michigan. Most of you are familiar with Flint and maybe Port Huron. Pontiac is about 30 miles north of Detroit, and Westland is about 20 miles to the west of Detroit. So PVM is, again, very committed to this transformational model. It certainly was not easy. It required a lot of alignment of different parties, but it is something that can be replicated either in total or in part if you really can work at it. And again, the best way to, I guess, come to appreciate Tomei Rivertown would be to schedule a visit to Detroit and see it firsthand. I'll stop at this point and turn it back to Michelle or Joe, whoever's
Sure.
moderating.
Thank you so much
Hey,
for all that info.
hey, Roger, can I ask you a question? This
Sure.
is Carrie. So one of the things that everyone's discussing in the chat is, does this, especially the skilled facilities or the assisted, are they regulated the same way that a regular skilled nursing or a regular assisted living would be? Is it the same with public health?
So great question. So we did not license any component of Tomei Rivertown as a skilled nursing facility. The greenhouses are licensed as what's referred to as home for the aged. So in Michigan, there's a there's two different licensing categories for what you may think of as assisted living. There's adult foster care and home for the aged. So we opted for the home for the aged licensure. For the affordable assisted living, there is a regulatory oversight that comes through the Medicaid waiver program. So, you know, there's certainly attention given through the Area Agency on Aging related to the care that's being provided. Certainly not similar to nursing home. And then, of course, CMS and the state health department are both very involved in regulating the PACE program. So we have regulations, but different than if it would have been an institutional nursing home.
I'll just add into that. This is Anne real quickly. Most small houses or greenhouses are regulated as skilled nursing facilities. That's how they're licensed. However, and I think somebody just put that in the chat. So yes, that is correct. It can be, as they were in the case of the Tommy Rivertown greenhouses, licensed under an assisted living licensure category. Occasionally, I think even something else besides that. So it depends on really what the developer and the state decide to do ultimately, but the vast majority are licensed as skilled nursing facilities. And
yeah,
just to point out, oh, go ahead.
Yeah, I should have said that we did build the greenhouses to skilled nursing standards. So if we decided in the future to actually license them, we could do that, but we opted not to do that.
Right. And sometimes it's not always a question of wanting a lighter regulatory touch. It's a question of not wanting to buy nursing home beds, which can be very expensive. So that's part of it. The other thing I just want to mention quickly is that the Program of All-Inclusive Care for the Elderly, or PACE, is licensed, totally different model, but it is licensed to provide care to people at a skilled nursing level of care. So that's why it can be used for the same population that is also served in a nursing home. So there are different flexibilities really that can be used to
So,
create
Anne,
a
somebody asked me
continuum
to
of
just
care.
repeat that again.
Repeat that again? Okay. So the PACE program, or the Program of All-Inclusive Care for the Elderly, serves a population that is at the nursing home level of care. Okay, so that's the same population that is served in a nursing home. So it's a question really of what kind of delivery system you want to provide, what you decide to raise money for, and so on and so forth. So if what you're doing ultimately is trying to build a broad community where people are served at different levels of need, then you could use PACE or a skilled nursing facility. You can build in assisted living at a lower level of care, if that's how it's licensed in a particular state. You should bring in Medicaid home and community-based services, clearly, if you are serving a lower income population. And that's what Tomei Rivertown is doing, is serving quite a low income population, which is amazing. So you can make the money work. The public funding is not enough by itself, but private financing can be obtained. They've shown how to do it. And it would be great if we could do a very sophisticated case study on Tomei Rivertown so that we can show how the governance works. Exactly how did those capital funds get put together? What are the operating subsidies? I tried to go through a little bit of that in some of the hypotheticals when I talked, but there's a lot more that we need to sort of write down on paper and show people how it can be done. So we hope to be able to do that.
Well, there's a question. Does anyone know, do you know if there are any greenhouse projects planned for New York State?
That is a question I'm not sure I can answer. I hope so. I believe that the governor set aside some money, to 50 million or so, to build better nursing homes. And those could be small houses. And I don't know what the status of that is. Maybe Jack or some other New York folks know, but that would be good catalytic funding for small houses and for continuum of care systems of the sort that we're talking about today. Because we're not just talking about a skilled nursing facility level of care. We're talking about the continuum of care from when you need a little bit of help all the way up to when you need 24/7 care. That's what we're really talking about here today.
So, and there,
I wanted to just also kind of bring us back a little to the demonstration project. How can people here participate in it? And what we've heard today is this fantastic example of how innovation can work. How is that going to be explored nationally or through a national demonstration project?
That is where we would love to have the help of everybody who's interested in this kind of work. And you're probably all doing, bits and pieces of it, maybe large chunks of it now or hope to. And if we can engage, the federal government, meaning the Department of Health and Human Services or CMS, and hopefully the Department of Housing and Urban Development to say, we see, that there are all these examples of much better residences and communities that can be built. So why are we financing the same old things that people don't want? So that is what the Einstein option is. It's a policy initiative that could be taken forward. We're open to a lot of input. It's an iterative, evolving proposal. If you look at it and study it and you see that we need to add something else in your opinion, we're open to doing that. But the point I was trying to make earlier is it's a tiny investment. It's just seed funding, catalytic, whatever you want to think of it as, to really get the ball rolling at a national level and to get a bunch of states and advocates and stakeholders really doing it, because we can build a blueprint that is ever so much better than the one we have today, which is an institutional model.
Well,
And would it be, and this is not just to you, Ann, but maybe to others. So when people refer to social determinants of health, what I often see written is that housing ends up being at the top of almost every list. So the integration of healthcare and housing in any of these demonstration projects or solutions or transformations, I think is really important. So the fact that you've got something that's proposing that CMS and HUD work together, and they do have conversations that occur between the two agencies, but my view is that they haven't been all that focused and they haven't really been consistent over the years. So I think something that can nudge, or more than just nudge, but to really get CMS and HUD at the same table, working on this type of a project, whether it's a demonstration project or is so important because it'll make a huge effect, and housing has got to be a key part of it.
so we have a great question from Drew Velting. Have any quality of life studies been conducted to provide evidence of the benefit of the greenhouse model? Do we have some hard metrics?
Definitely. Susan
Go ahead,
Ryan,
Roger.
is Susan Ryan with us or not?
I do not believe so.
No.
Alex signed up, but he doesn't appear to be here either.
But you absolutely, there have been many different areas of research that have been done over the years, and Susan would be the best person to speak of it, that have quantified the quality improvements, not just in the clinical areas, but certainly all social cyclical aspects of life that have been really well documented.
Yes, I think that's right. And we can, with Carrie's help and Michelle's help, we can find some links and send them out so that you can take a look yourselves. We mostly talked about savings today, and there's evidence for those in the small house model. But there's also evidence of much greater satisfaction on the part of staff as well as residents living there. And it looks really, really good, which is why we're so excited about it.
And as Joanne Rader pointed out, not all small house models are greenhouse. There are other programs out there.
Mhm.
Just greenhouse is the one that people know the best. You know, this is not about one model. This is about what can we do to improve the system, to make the homes safer, and to have a better quality of life for everyone involved, from the staff to the residents. Ann and I met with the gentleman a few weeks ago from Wyoming that the state of Wyoming itself opened 10 houses for adults with developmental disabilities, just like my son. And it is state run because statistically they saw the benefit of going to the small house model.
Mhm.
Yes, they did it through greenhouse, but it would have worked either way.
Right.
And just, I want to remind people that the Einstein option is about evaluating innovations. So as people have new or different models, whether they be greenhouse or others, that gives a national platform for the potential for transformational change.
Correct. I had an idea. I don't know whether people like this idea, but in terms of getting CMS and HUD to work more closely together, I believe, if I'm right, Roger, that HUD Secretary Marcia Fudge has actually visited Tommy Rivertown. I don't know that the CMS administrator, Chiquita Brooks LaShure, has, but it would be amazing if that could happen. Maybe we should write a letter suggesting that, and I'll
Yeah,
sign it.
yeah, we would welcome that. And you're right. Secretary Fudge, in her first year as secretary, did visit Tomei Rivertown, and we've had many visitors, different, from different parts of the government, but not the CMS, not the administrator of CMS. So we would absolutely welcome that.
So, and we, as a group, have presented the proposal to Senator Ron Wyden. What are the next steps that you propose so that we can get the ball rolling?
Well, I think that if we, again, I believe that letters are paid attention to. We could have a group sign-on letter to Senator Wyden saying, we really would like you to pay attention to this kind of transformative initiative. I think he might be up for it. He is a Gray Panther himself, loves to cite his experience as a Gray Panther in Oregon. Of course, he is the chairman, as you may know, of the Senate Finance Committee, so very important. There are other members of Congress that we believe will be visiting soon. All of you would be welcome. Haven't even asked yet, but it would be in the latter part of March. If any of you are in the Washington, D.C. area, you'd be most welcome to join us. So some of the other folks would be Senator Whitehouse of Rhode Island, and maybe Rick Gamache wants to say a word about that. And probably Senator Grassley, who's long been a champion of nursing homes in the Republican Party. So we need to get the word out, basically. And any of your connections that you already have would be fantastic if they can be leveraged.
So a call to action would be that we can provide a letter to
Yeah.
everybody on this call to
Yes.
send to their senator. Okay.
Absolutely.
So we can do that when we send out the recording. So let's see, are there other questions here? There's a lot of chat, I'll say.
So can I make a suggestion here?
Go ahead.
So if we are going to start any kind of letter writing campaign, anything of that sort, we should try to get this as organized as possible. When we were trying to get attention with CMS during the pandemic to get families back in, we flooded them with letters, but we flooded them with letters that every letter was in the same yellow envelope. And even though we know that there's no way that CMS read them all, but after a couple hundred letters showed up in Evan Schulman's office in yellow envelopes, he couldn't miss the point. Whether he ever opened them all of them or not, the envelope itself made a point of why they were showing up in his office. And we had thousands of them sent when we did it. Somebody
want-
had,
I just wanted to note that Alex has his hand up. Alex,
Yes, can you hear me?
yes.
yes,
Hello, everyone. So, again, for anyone who may have missed my introduction, I represent Senator Prasad, District 19, Brooklyn and parts of Queens, in New York City. So I just want to let you guys know that you could always call your elected officials' offices and ask what their steps are for grant proposals and stuff to assist this initiatives, right? So for example, our office does provide grants. It is limited because the government doesn't have a lot of money, contrary to what your taxes are. But so we do provide grants throughout our district. So you could always again call your senators or your local senate, your local assembly. If you're in a city, you probably have a city council, right? Sorry, a community board, and you probably have council members that also provide funding. And usually you don't need to send a lot of letters or in mass. I mean, if you want to get their attention, probably, but usually elected officials are very much aware. It's typically the ones who are working in Congress that's a little more difficult to get their attention. So like in New York, you have Senator Gillibrand, Chuck Schumer, Hakeem Jeffries is in the House of Representatives. You would have to send them a lot of emails to get their attention, or not emails, but letters to get their attention. But always reach out to your local elected officials and ask them for what their requirements are. So they'll ask you for certain documentation, certain outlines of what you want, so on and so forth.
Great, thank you. Also, somebody's pointed that Lori Simon Rusinowitz mentions that in addition to hard metrics, she was recommending focus group data and quotes from people in the facilities as something that we can use to convince policymakers that this is the route to take. Do we have access to that sort of information? Are there focus groups or?
Well, there's a lot of stuff coming out of Consumer Voice, and even there are clips from various documentaries that could be easily extracted.
Mhm.
And so when is the hearing in March, and when,
Yeah,
what is the date? Or is it,
there
is
is
there,
no date
oh,
yet.
there's no date, okay. So nothing is set. All right, so I guess the call to action is really for everybody to write a letter, and we can provide a template.
Mhm.
And that would be the next step before you and then take the proposal to DC. Is that?
Yeah, that would
sound-
be wonderful to be able to hand something over to Senator Wyden or any other member of Congress. Jan Schakowsky from Illinois in the House is a real champion. So we will be meeting with some House staffers as well. If we had that letter in hand, or at least, mostly done, we can always add more signatures. That would be amazing. That would help our case.
Okay.
Also, Alex, you said that you're working with the state. Let's work together on
So
as we can. Alex Spenko and Alex from Senator Persaud's offered, but yes, in both sides, I think that makes a nice triumvirate, as well as LTCCC and others who are on this call.
so why
Absolutely.
don't we work on this letter, and we have a list of everybody that registered for today. And we can send everybody an email asking, would you like to help and sign off on this letter? So then you can give us permission to add you to the letter that Anne will be carrying around to our legislators in DC.
yeah, and get your local electeds involved as well on the letter. That would look really well if you have representatives from the state and assembly. In conjunction working with you on sending this letter, especially if they can get again House of Representatives and United States Senate members on board with it.
Thanks,
Love
Alex,
to
for
work.
helping us.
Yeah, I love to work with you, Alex. It's amazing to have the states
So
involved and
absolutely,
state
and right now, like
legislators.
I'm writing a report on everything that's going on in this meeting. So Senator Prasad would definitely be saying, she reads everything, I promise you. Every email, she knows everything. So she will be reading this report, and if you want to set up a meeting with her, specifically, she's the chair for social services, which is not, you know, really housing per se, but she's very big on you know, the rights of the people, the well-being of the people, the seniors and stuff. So she's the chair for social service committee, and I'm pretty sure she would love to speak to you guys if you guys email us and request for a meeting. And
That's great.
she's very well established and well connected.
Fabulous.
Who's her scheduler? Can you
Yes. So I'll
put it in the chat? Thank you.
I actually have the scheduler's information from earlier.
Oh, okay.
So
Terrific. All right.
I'd like to just
Go ahead.
to share, again, maybe you're all aware of this, but the National Bipartisan Center on Policy, I think last year, they published a pretty extensive report on PACE. So if you've not seen that, you might want to get access to that report that was put out by the Bipartisan Center. It's very informative.
Who's speaking?
That's Roger.
That was Roger.
Roger Myers. All right.
Roger,
Well,
can you send me that report, please? This is Carrie.
Yes, is that? Yeah, I'll
Yep.
send it to you, Carrie. Yep.
Thank you. And the same thing, one of the things that I'm working on doing currently is compiling reports and, you know, even news articles, anything that are talking about smaller house models, innovation, changes in long-term care. So if somebody sees an article that is beneficial, please send it to me or send it to Gray Panthers and they'll get it to me. My goal is to have as much ammunition for Anne to have as possible whenever we go to DC or who goes. You know, and the more information we can give them, the better.
Right.
that sounds great.
Sounds
I
great.
love that we have a call to action today. So we're going to have a letter. We're all going to share it. Hopefully, everybody please sign it, and we will deliver it to Anne so that all our voices can be heard. So we're at the end of the hour. I just want to thank everybody for being here today and for all your support. I also want to invite you to come back next month on March 26th. We have another very fascinating speaker from Switzerland, Vincenzo Paolino. He's based in Zurich. He's the founder and CEO of a chain of nursing homes called Alma Casa, which offers also small, innovative residences with chandeliers in the bathrooms. I've seen photos. And he's also the president of Queer Alternative Switzerland, an association that brings together talent and money to offer a home for queer seniors and friends who want a place to feel comfortable and secure in end of life. So thank you, everybody. This has been recorded. You'll be receiving the recording as well as this letter that we want everyone to sign.
Emily, when
I'm
you
so
send the
sorry.
recording, will people have access to the chat? Because that I've seen that question now about 10 times.
Yes.
yep, I can make that available.
Thank you.
Yeah, and Miss Emily, I don't know if you saw my question. Is there any way you can forward me the slides so I can
Yep.
submit them?
I will send them to you right now.
All right, thank you so much. You all enjoy your day. Thank you so much
Yeah.
for the informative session.
Thanks.
You
Thank
all
you.
are
Thank
amazing.
you.
We'll see you later, Alex.
Absolutely.
Thank you.
Thank you
Thanks for
guys.
coming. Bye, everybody.
Bye.
Thank you, and Roger, very much.
You bet.
Beautiful project. Beautiful, beautiful webinar. Beautiful.